Hi, Dr. Salihah and my fellow friends. We are from Group 2 and we want to present about the case study 2. Here is our group member, which are BINTI, FAQQIHAH, LIJIE, FATIN and VOON. Now I want to discuss the background of the patient. Her name is Siti and she's married. She's a teacher and she has no non-medical illness. She is 42 years old Malay woman. And from the family history, her father and mother have getting the type 2 diabetes and hypertension. Here is the Siti diet history. For the breakfast, she consumed a glass of tea, a tablespoon of the condensed milk, a plate of a fried meat or nasi lemak. For lunch, she consumed 1.5 cups of the white rice, a piece of the fried chicken or fried fish, half cup of the stir-fried veggie, a glass of Milo without sugar added, and fruits such as the watermelons or orange. Then for the dinner, she consumed a pack of the chips and also a bowl of the maple soup. So from the food checklist, we know about she likes to eat high sodium foods such as the cans or processed foods. And she also frequently used the flavoring agents such as Ajinomoto and sauces. She has tried numerous weight loss programs. She also has followed a strict diet and had never exercised in previous weight loss attempts. Her lowest body weight was 76 kilograms at age 35 and maintained for 1 year. She also complains of having limited healthy food choice at the school canteen.
Assessment.
For the assessment, we look through the anthropometry, biochemical, clinical, and dietary intakes. The BMI cut-off point formulation was used to classify the weight, and it is recommended by the World Health Organization's expert consultations in 2004. The calculated BMI is 32.58 kilograms per meter square, and it is classified as obese class 2. In terms of the biochemical, the fasting blood sugar, random blood sugar, and HbA1c, which is glycosylated hemoglobin, was measured. A 5.9 and 6.5% of HbA1c was measured, and they were all within the normal range. In terms of the clinical, the hypertension is also out of the normal range, which is 154 for the systolic blood pressure and 90 for the diastolic blood pressure. For assess the dietary intake, it was mentioned in the background as mentioned by BINTI. For the analysis of the diet history, we observed that the teachers always consume high fat, which about 53% and 43% of carbohydrate, and followed by the 10% of protein.
Diagnosis.
The first is diagnosis NC3.3, which is overweight or obesity. Obesity is due to excess energy intake due to limited food choice as evident by inadequate eating pattern. Siti we categorize as obesity related to a large amount of sedentary lifestyle as evidenced by BMI 32.5 that can be categorized as obesity class 1. Next, for NI 53.5, which is inadequate fiber intake due to lower intake of fiber containing food or substance compared to recommendation based on physiological need. As stated, Siti consume only 1 serving of vegetable per day and eat fruits only when available. Next diagnosis is NI 53.2, which is excessive carbohydrate intake explained by overconsumption of carbohydrate than recommended standard or recommendation based on the psychological needs. The carbohydrate intake that is consistently above the recommended amount. As evidence, Siti were inability to control the limit of high sugar drink, such as drinking tea with additional condensed milk and Milo for a day. Other than that, Siti also diagnosed as excessive intake of sodium, which is as evident by the reading of high blood pressure and eating canned food and processed food.
Intervention.
Intervention for physical activity. Siti can add an active routine such as gardening, cleaning house, or indoor exercise since she has a limited time as a teacher and married woman. Siti also can enhance her daily step or brisk walk. Other than that, it is recommended that individuals with diabetes engage in moderate intensity aerobic physical activity for at least 150 minutes per week, which is between 50 and 70% of their maximum heart rate. Exercise that are suggested including cycling and brisk walk. Next, for intervention dietary intake, a home meal food is the best option if Siti want to control her weight. She can cook healthy food with less oil. Other than that, Siti also can add fruit cuts and vegetable in her daily meal. She also needs to increase fiber in her daily meals for 2 or 3 servings per day, as mentioned in DASH diet. In addition, Siti need to increase her plain water intake. Siti can apply to bring a water bottle to school. She also need to drink at least 2 liters of water per day. Other than that, she also need to reduce sugary drinks from twice per day to once per day or once per 2 days.
DASH diet is known as dietary approach to stop hypertension. It is a comprehensive dietary strategy aims at addressing various health concerns, particularly hypertension. So the DASH diet encourages the consumption of nutrient-rich food, including fruits, vegetables, whole grain, low-fat dietary product, and lean protein. So this approach offers a range of health benefits such as lowering high blood pressure, supporting weight loss, reducing the risk of heart disease, managing or preventing type 2 diabetes, improving HDL cholesterol level, and lowering the likelihood of kidney stone. So in engaging with the patient, it's crucial to highlight specific nutrients that can be a positive impact on her health, considering her family of type 2 diabetes, mellitus, and hypertension. So it is important to note that the fat can be characterized into monounsaturated fat, polyunsaturated fat, saturated fat, and trans fat. So in this context, healthy fat included monounsaturated and polyunsaturated fat, while saturated and trans fat are classified as unhealthy. So consuming a healthy fat has numerous benefits, including lowering the risk of heart disease, improving blood glucose level, aiding in blood sugar control, and reducing the inflammation. So the food that rich in polyunsaturated fat included walnuts, salmon, soybean, tuna, and eggs that have the essential omega-3 and omega-6 fatty acid to play the role in brain function, skin and hair growth, and immune health and metabolism. So while monounsaturated fat can be found in avocado, nuts, seed, and olive oil. So in the sodium and chloride, the Malaysian dietary guidelines stated that salt is made out of ion that are both sodium and chlorides. So other type of sodium include sodium nitrate, sodium benzoate, and also MSG. So normally, sauce like tomato, chili sauce, flavoring like Ajinomoto have the significant MSG content, which raises the salt consumption. Potassium is a vital nutrient that is essential for our body, so that we cannot internally synthesize and must be obtained through the daily dietary intakes. So the food that rich in potassium included banana, avocado, sweet potato, spinach, and coconut water. So the function of potassium encompasses mitigating the impact of sodium on blood pressure, providing a protection against stroke and cardiovascular disease, aiming in the prevention of osteoporosis and reducing the risk of kidney stone. So as recommended by the WHO, the dietary intake of potassium is at least 90 millimole per day. So this recommended level aims to contributing the control of blood pressure and also reducing the risk associated with cardiovascular disease, stroke, and coronary heart disease. So in the dietary fiber, it's advised to increase the intake of dietary fiber due to the benefit of including promoting satiety, supporting digestion health, and also help manage blood sugar level. So in the sugary beverage, it's recommended to substitute with plain water to help reduce the calorie intake and facilitating weight management. Therefore, cultivating the practice of drinking plain water daily is essential for overall health and well-being.
Monitoring and evaluation.
For monitoring and evaluation, we can create a meal plan, which is a suggestion for Siti to reduce at least 500 calories per day. It can help Siti reduce weight and manage her disease. For behavioral changes, Siti needs to be more physically active and not repeat her current lifestyle. Other than that, for monitoring anthropometry, biochemical and clinical at week 6 to 4 months, Siti can monitor her weight, BMI, glucose control, total cholesterol, LDL, HDL, or any clinical symptoms such as hyperglycemia or hypoglycemia. Other than that, Siti also need to do a weekly inspection or monitoring blood pressure or blood glucose level.
The reduced energy diet with additional DASH diet should be considered, and the 22 kilograms per meter square is used as the ideal BMI to calculate the ideal weight, which get 58 kg. Calorie intake was calculated as 1740 calories, and the fiber intake should be about 20 to 30 grams per day, and it was recommended by the Malaysia Dietary Guideline in 2010. Macronutrients distributions, 45% is contributed to the carbohydrate and 20% is contributed to the protein, and followed by 35% of fat. This percentage is important to create or generate the meal plan.
This is the suggested meal plan for Siti using 1,720 kilocalories per day to improve her diet. When following this diet, we should follow the recommended servings for each food groups. For grains, patients should have 6 to 8 servings per day, such as whole wheat bread or half a cup of cooked rice for 1 serving. For vegetables, patients should consume 4 to 5 servings each day. Example of 1 serving of vegetables are half a cup of cooked veggies or half a cup of vegetable juice. For dairy products, patients require 2 to 3 servings per day, with 1 serving equaling to 1 cup of low-fat milk or yogurt to minimize calorie intake while increasing calcium intake. Patients also need to consume lean meats, poultry or fish as protein sources in 6 1-ounce servings or less per day. Furthermore, fats and oil should be consumed in 2 to 3 portions per day, with example of 1 teaspoon of vegetable oil or 2 teaspoons of salad dressing. When it comes to sweet and added sugars, 5 servings or less per week are required, with 1 serving equaling to 1 tablespoon of sugar or 1 cup of lemonade. Following this diet also means to reduce salt intake. Strategies to follow a low sodium diet are by reading food labels, selecting low salt food products, and to request less salt when dining out. In terms of cooking tips that could be practiced by Siti to improve her health, it is recommended to use herbs and spices for flavor and to pick healthier cooking methods such as steaming or roasting. Practicing these methods can also enhance the flavor while keeping nutrients of the vegetables. Moreover, Siti can make sauces using healthier ingredients such as olive oil, herbs, vinegar or lemon juice to avoid harmful fats in meals. She can also replace refined grains in recipes with whole grains such as brown rice or barley. Moreover, Siti can make sauces using healthier ingredients such as olive oil, herbs, vinegar or lemon juice to avoid harmful. When analyzed, it is found that the patient regularly consumes ultra-processed foods that often contain trans fat. Given the patient's family history of hypertension, it becomes imperative to advocate for a reduction in the consumption of processed foods. This dietary adjustment is essential to mitigate the risk of hypertension and contribute to overall cardiovascular health. This is the suggested meal plan that can be used for Siti with breakfast, lunch, afternoon tea, dinner and supper based on 1,720 kilocalories per day.
References.
That's all of our presentation. Thank you for watching our video. Let's eat healthy.